I'm calling an audible and making this second video for those of you that still are not in favor of unionizing. Let me start by saying I don't think I need this video. I'm pretty sure that most of us have just about had it. I don't think I need this video because I get phone calls and text messages every single day from people across this organization who I have never met saying, I can't believe they're doing X, Y, and Z. I don't think I need this video because when I first handed out union cards, over 84% of people that got one returned it back signed. And even though we've grown since then, I think the vast majority of people that work here are on board. But this video is for the rest of you. If you're one of the remaining holdouts, then I'm just going to give you the top 3 reasons why you need a union, even if you may not want one. Reason 3, pay. We need a pay plan. If you look at the nurse's pay plan, you'll notice that as you make it to the next bracket of experience, your pay goes up. Also, as time passes, the pay in each of those brackets goes up. When you have a pay plan, longevity is rewarded and people want to keep working here. Day shift nurses start at over $75,000 and go up to $116,000. Night shift nurses range from $87,000 to almost $134,000. On the EMS side, 20 years of experience might get you about $3 an hour more than a new guy. When you don't have a pay plan, what you end up with is this. You end up with 13 and a half years of no increase in the starting pay for BLS. And when they finally did raise it, it still wasn't enough to get you guys off of food stamps. When you get to negotiate with your employer, you also get to bargain for other financial benefits. For example, the nurses' night and evening differential is actually 12 and 15%, unlike ours. Nurses, unlike us, also get paid for their board certifications. The nurses also have a 4-step clinical ladder with pay increases at each step. These add-ons can add over $9,200 a year to their pay, bringing top-out pay to just over $125,000 for day shift and almost $143,000 for night shift. That's 3 shifts a week with not 1 hour of overtime. EMS, we get nothing. Well, not nothing. I'm sure you were relieved to know management completed their salary study. So you either got a letter saying, here's another 20 cents or whatever, or you got a letter saying that you're adequately and properly paid. That's the salary study that took them months to come up with. Here's a salary study. I can think of 25 coworkers who rely on constant overtime or work multiple jobs to make ends meet before I can think of 3 that make it on just their full-time job here. That salary study took me 10 seconds. Our salary is shameful. We have BLS on government assistance. Look, I've heard the argument that unions protect bad employees, and historically that might be partially true, but having people do high-risk work for almost minimum wage with no longevity, that creates bad employees. When you're underpaid and you have anti-employee policies, you end up with exactly what we have, over 90 vacancies. That in and of itself protects bad employees because they need every ass in the seat and they can't afford to get rid of the dead weight. This may be an unpopular position for a union guy to have, but there's people who work here that shouldn't, and there's people that work here who don't deserve to. Rick Lasky said it best. This is one of the only professions where someone will hand you their sick or dying child. There's an inherent trust the public places on us, and with that trust comes responsibility. And there's people that work here that just can't handle it. If Robert Wood Johnson wants proficient clinicians and quality employees, they're going to need to open their checkbooks. Without doing so, it results in what we have, a revolving door of workers at a stepping stone agency made up of employees who are either disgruntled, waiting to get hired somewhere else, or both. If pay isn't enough for you, reason 2, contract supersedes policy. Someone told me last week that there are union people and people who just haven't worked here long enough. I don't think that's necessarily true. I think if we needed hundreds of people to show up at the next Barnabas groundbreaking or hospital takeover, holding signs reminding them that, heroes also work here in moldy trailers with rotted out floors that people have fallen through because our managers think that's acceptable. I think our Newer and younger employees would be very well represented. I think the truth is that there are pro-union employees and employees that just aren't paying enough attention. An experienced provider told me last week on the New Jersey paramedics page that we don't need a union because we work for Robert Wood Johnson and not some mom and pop agency that's going to cut our benefits. That's someone who's just not paying attention. Let's look at what they've cut from us just in the last 6 weeks. Mind you, all of these morale boosters would have been the subject of mandatory bargaining. In the last 6 weeks, our funeral leave was reduced from 3 shifts to 2. Day shift paramedics will now only get 11 hours of holiday pay instead of 12. They also unilaterally decided if you call in sick on your assigned weekend, you now have to pick up a shift on your unassigned weekend. Additionally, even if you're not scheduled to work a holiday and you use sick time before or after a holiday, you're no longer automatically entitled to sick time pay. And the best thing to happen in the last 6 weeks, the one medic, one EMT policy. We've been doing this for a while, but I guess now that it's standard operating procedure, it was time to issue a policy. The state first issued one medic, one EMT waivers and one EMT, one first responder waivers due to COVID. And I get it, they didn't know if hundreds of us were going to be quarantining or dead from inadequate PPE, but now we're using this waiver all the time. And I might be wrong, but I'm not aware of one paramedic that's out sick right now with COVID. Last weekend, we had more one-on-one trucks than regular ALS trucks. We're using this waiver to fill gaps that are created by inadequate compensation and poor management practices. Something tells me the nurses union would have a lot to say if Robert Wood replaced every other nurse with a CNA or an LPN, but Robert Wood doesn't think twice about doing it to us because we don't have a union. We don't have an organization to step up when some kids drown or the unimaginable happens, and it will, to tell every news camera and media outlet that Robert Wood chose profits and chose to reduce the level of service. We don't have a union to tell people that staffing is critical enough that we reduced services, but not critical enough that we couldn't even enact our own critical staffing policy. Mr. Ruffino said this one-on-one program is voluntary. If you're one of the medics that's signing up for this, I don't know what to tell you other than you're signing up for this from now on, forever. They have systematically turned this career into just a job, a place where people leave because they can be happier and make more money elsewhere. These 90 plus vacancies we have, they have way more to do with a culture pandemic at Robert Wood EMS than a COVID pandemic. You may think that by volunteering for this, you're helping the system, but in actuality, you're just hurting your profession. There's, 1,000 of us that do this in a state of 9 million people? That by itself makes us valuable. We're finally in a place where we may be in a position to negotiate, and you're gonna let them get away with this? Remember, they didn't care about us enough to enact a pronouncement waiver. They were literally risking our lives sending us into COVID units of nursing homes for a $60 pronouncement reimbursement. And now you're gonna let them get away with this waiver so they don't have to tell their bosses that they failed? Look, in the last 6 weeks, they changed our bereavement, our holidays, vacations, our hours, and our working conditions, and none of them for the better. And they will continue to treat us like this only as long as we let them. Maybe the poor pay and morale suppressing policies aren't enough for you. Maybe you're concerned about union dues. Maybe you're in favor of unions, but you just don't like the IFF because you were a member of Local 4610 and it didn't work out and you have a bad taste in your mouth because of PEMSA and Monarch. This is how unions are supposed to work. In Florida, I paid IFF dues. A portion of them went to the national IFF, a portion stayed in our local, and the rest went to our state lobbying and political action organization, in that case, the FPF. The FPF then interviews and vets candidates running for office whose values align with ours. They select those candidates and they get them elected. They create legislation that helps. When politicians try and pass legislation that hurts their members, they do everything they can to get them voted out of office. The FPF has successfully lobbied for a $75,000 first responder death benefit, double if you die in the line of duty, your survivors don't pay property taxes, and your kids get free college education. They passed a law preventing insurance companies from charging you more because of car accidents at work. Exempted EMTs and paramedics' names and addresses from public records. Created a disciplinary bill of rights for fair disciplinary hearings. Passed laws making HIV, hepatitis, meningitis, and tuberculosis automatically presumed to be workers' comp. Extended workers' comp protections even if you're not at work or in your jurisdiction and you're working within your scope of practice. They added EMTs and paramedics to the special risk of the federal retirement system. EMTs and paramedics are able to purchase eligible time and convert it to special risk, which is a 3% multiplier. That means if you work 25 years, you retire at 75% of your pay. Some of these changes are game changers. In New Jersey, we have BLS Narcan. New Jersey needs a professional organization lobbying on behalf of professional EMTs and paramedics. If we took the same amount of money we were paying at Monarch to the PFA&J and kept it in-house, with the size of our organization, it would give us over $197,000 a year. State and local election cycles are every other year. That's $400,000 per election cycle to try and affect positive change. And if you don't think we need this, understand that while we're busy not lobbying for our interests, our employers are busy lobbying for theirs. The New Jersey Association of Paramedic Programs, which claims to be a voice for all paramedics across the state, but is actually an organization comprised of the directors from each of the hospital's MICUs, they have a legislative agenda. Their website states, the most important contribution we've made is the introduction of New Jersey Senate Bill 3885 and Assembly Companion 5891. If you work as a medic in New Jersey and you want to know your employer's intentions, read these bills. There's your One Medic, One EMT and the foundation for your One EMT, One First Responder. Not only does this bill create paramedic assistance, changes the definition of an MICU, creates intermediate life support and paramedic support units, it gets way worse. They didn't bother to try and take anything that's broken out of the EMS legislation. They even left a representative from the First Aid Council on the BLS Advisory Board, which if you're a career EMT or paramedic in the state and you think the First Aid Council should be in charge of anything, call me, we'll get you tested, we'll get you the help you need. Since 1987, it's been recommended that all ambulances in the state be licensed. They didn't try and fix that. They didn't try and mandate that municipalities publish response times. They didn't try and come up with a funding mechanism. They didn't try and tax weed, I don't know, something. They did exactly what you think they would do. They solidified that paramedics are married for life to hospitals and can never work for counties or municipalities. And best of all, they tried to put themselves in charge of everything. They created an ALS oversight board, which has enormous power. It would have the power to make the requirements for licensure as a paramedic, determine our scope of practice, what's carried on ALS vehicles and paramedic support vehicles, gives them the exclusive authority to dictate our protocols, what equipment, medications, and procedures we perform. Additionally, the bill would take away most of the power from the state and allow the ALS Oversight Board to control recertification requirements, investigations, discipline against your license, etc. Here's the best part, and I know you'll find this shocking. The ALS Oversight Board consists of themselves. It's the directors from each hospital system. The same people who consider disciplinary due process to be sign here and resign or we're firing you want to be in charge of discipline against your license. The same people who put out policies saying we can't use our personal cell phones on shift, but our patients can use our personal cell phones on shift, or policies that say that BLS should continue CPR when presented with a valid DNR until ALS arrives. Those are the people that want to run the show. Imagine the arrogance, ego, delusions of grandeur that must be involved in running an organization that's operationally so ineffective, so flawed, and to think that you're doing it so well that you should control everything. If you're not on board with organized labor, the loons are telling you they want to run the asylum, and by not getting on board, you're handing them the keys. You need organized labor. I understand. Some of you might not like the IFF. I can tell you the IFF has a lot of advantages. First, the IFF is cheap. Their dues are substantially less, in some cases 70 or 80% less than other other labor organizations. Not only that, the IFF is one of the only labor organizations that doesn't require you to also join their PAC. This keeps more of our dues in-house to use for EMS issues. But the main reason is, when it comes to electioneering, when it comes to getting and keeping candidates in office that support our agenda, no one is better than the IFF. From super voter lists to mailings to computer software, no one does it better. The time to fix this is now. We need a professional organization. Even those of you that are against unions have to agree, we need a pay structure that keeps people here. We need better benefits. We work for one of the biggest hospital systems in the state, yet every time one of us gets sick or injured, we rely on GoFundMes. We need a fair disciplinary process. We need better mental health resources. Almost 90% of those surveyed say they wouldn't report a problem with drugs or alcohol, and over 80% said they would not seek help for depression or suicidal ideation for fear of losing their jobs or licenses. We need a truly non-disciplinary QA process. We don't talk about our mistakes. For an organization that does what we do, that's fatal. We need a lot, and if you haven't noticed, they're not rushing to give it to us. The most effective way to get to where we need to be is through organized labor. That's why I'm asking, if you haven't already, go to join5204.unionsignup.com. It takes about 10 seconds. Site's only going to be open for about a week. Next Tuesday, all paperwork and supporting evidence will be submitted, and that puts us on track for a hearing no later than August 6th. Again, join5204.unionsignup.com.